Hello, Internet. I apologize for not getting a video up yesterday. I actually called out from work. I was not feeling well at all, so I spent the day yesterday getting some much-needed rest. And today I had that chemo class that I mentioned where I sit down and they explain to me what I can expect from the upcoming infusion. Um, and enough happened with that kind of convinced me to make a video about that rather than the good news video that I was going to make. So that's going to have to wait until tomorrow. I'm sorry. But it's coming, and it is good news, so just bear with me. Before I even went to the oncologist, I was feeling pain in my liver area and pain in my chest, like kind of dead center. And at first I thought it was heartburn, but it's in a place that doesn't feel like where heartburn would be, and it just doesn't feel like I've had heartburn, and it doesn't feel like heartburn. So I brought these up at the oncologist's office, and they basically just said, like, keep an eye on that and let us know if anything changes or if it continues and doesn't go away. So then I was brought into a room, sat down with the nurse, and she began going over the infusion and the side effects, the possible side effects with me. And the more she talked, the more afraid I became. So I'm reading from a thing they printed out for me. Panitumumab is what it's called. Starts off right at the top, warning. Skin problems like acne, itching, redness, rash, and dry or cracked skin are common with this drug. Very bad skin problems, infections, and tissue damage have also happened with this drug. Sometimes these have been life-threatening or deadly. Talk to your doctor about any skin changes you may have, a severe skin reaction, Stevens-Johnson syndrome / toxic epidermal necrolysis. Necrolysis. It may happen. It can cause severe health problems that may not go away, and sometimes death. Get medical help right away if you have signs like red, swollen, blistered, or peeling skin with or without fever, red or irritated eyes, or sores in your mouth, throat, nose, or eyes. And it kind of goes on like that. Like, the more she talked, the scarier it got. And what are some side effects that I need to call my doctor about right away? Even though it may be very rare, so, that's nice to hear. Some people may have very bad and sometimes deadly side effects when taking this drug. Tell your doctor or get medical help right away if you have any of the following signs or symptoms that may be related to a very bad side effect. Signs of an allergic reaction like rash, hives, itching, red, swollen, blistered, or peeling skin with or without fever, wheezing, tightness in the chest or throat, trouble breathing, swallowing or talking, unusual hoarseness or swelling of the mouth, face, lips, tongue, or throat. Signs of fluid and electrolyte problems like mood changes. Mood changes? That's scary to think that could affect my mood. Confusion, muscle pain, or weakness. A heartbeat that does not feel normal. Very bad dizziness or passing out. Fast heartbeat, more thirst, seizures, feeling very tired or weak, not hungry, unable to pass urine or change in the amount of urine produced, dry mouth, dry eyes, or very bad upset stomach or throwing up. I love how often they use the term very bad. Fever or chills, change in eyesight, eye pain, or very bad eye irritation. There it is again. Mouth irritation or mouth sores, change in skin or fingernails. She said that fingernails can actually become brittle, and that can be bad. That can lead to an infection at the fingernail bed, and I have to keep an eye out for that. Redness or irritation of the palms or of hands or soles of feet. Blood clots in the lungs have happened with this drug. Blood clots in the lungs may be very bad or life-threatening. Call your doctor right away if you have chest pain or pressure, coughing up blood, fast breathing, fast heartbeat, or shortness of breath. Some people have had lung problems with this drug. Sometimes this has been deadly. Call your doctor right away if you have signs of lung problems like shortness of breath or other trouble breathing, cough that is new or worse, or fever. I'm not gonna continue. You get the idea. This is Like, I get it. They have to tell me everything. They have to tell me every possible thing that can and might happen, even if it most likely won't. But when you lay it out on the table like that, that is terrifying to hear. And for something like this, I seriously wonder if it's worth it. Because up until now, all of my treatments have been designed to save my life. And when I was undergoing chemotherapy, I could approach the side effects with that in mind. No matter how bad it got, I always had it in my head that it was for the greater good. That I could suffer through side effects if it meant that I was going to live. But now that's not going to happen. And the best case scenario with this is that it will extend my life a little bit. And in theory, improve my quality of life. However, it presents the possibility of making it worse, or worst case scenario, killing me. So now I am left with a very difficult decision, and I told her I was having second thoughts, that I would have to go home and think this over. And they rescheduled me to meet with the oncologist next week. He was going to see me, I think, like a week after my first infusion, which was supposed to be next week. But he's going to see me next week, and hopefully by then I'll have a decision. I will have made a decision. I honestly don't know what I will pick, because it is absolutely, it's crazy. On the one hand, this could give me some extra time, and that would be great. On the other hand, it could give me less time, significantly less time, and I could suffer during that time, and that's bad. So I don't know. I don't know what to pick, and I don't know what to do. I am sure that more than likely, whatever side effects I do experience, they won't be that bad. And I have the option of stopping at any time. However, as it says in the handout, very bad and sometimes deadly side effects have happened during the infusion. That means that even the first time I take it, I am opening the door to the risk of death. Now, what the nurse said is that the oncologist would not present this to me as an option if he thought that this was a likelihood. He would not even accept it as an option ever if he thought that this was something that was remotely possible. And that's good to hear, but it doesn't stop me from thinking that I am rolling the dice. And it's kind of like a game of Russian roulette. And you might have a gun with 1,000,000 chambers in it, but are you really going to take that chance to spin a barrel with 1,000,000 chambers and one of those has a bullet in it? So I don't know. I mean, there's a host of other side effects I haven't mentioned. Sensitivity to light, sensitivity to the sun. I would have to cover up and wear sunscreen if I'm going to be outside. And that's even if I'm only outside for a little while, because very bad side effects can occur where my skin burns very easily in the sun. So I'm left to wonder what the right thing to do. And at this moment, I don't have an answer to that. So I think I'm just going to have to spend some time thinking about it. I don't know who else to talk to about it. I suppose I could seek a second opinion. I don't know who I would go to. For now, I just can't decide. So I'm not going to. It would be so much different if it was a matter of life and death, and it's not, because my death is a foregone conclusion. I don't know. I guess I'll just play it by ear and figure it out along the way. So yeah, I guess that's kind of it. That's kind of where I am now. So it'll take some time for me to figure this out. I've got that good news. Couple of good news items, actually. And I'm really looking forward to sharing that with everyone. So there's at least that to look forward to. And I'll be sure to put that out probably about midday tomorrow. Oh, and real quick before I stop this video, a while back I had started doing this, and I'm going to start doing it again. Kind of a way to, respond to my viewers. I'm going to scroll through my comments on the last video, and I am going to respond to some of them. I'm not really picking out anything in particular, just whatever catches my eye. And I'm only going to do a handful, but I do want to say that I have read through many of the comments on the last video, and really all of my videos, and I appreciate all of your kind words. I am seeing a lot of comments regarding the cost of healthcare in America. Yep. I mean, that is a topic for an entirely different video, if I decide to make it. I tend not to go on rants, but I do have things to say about that, and the short version is, if someone can sit me down and talk to me like I'm 3 and explain why America can't have socialized medicine, that would be great. Melissa Joy says, that smile of yours has the power to shine on every dark place and definitely outshines the sun. And then she has a little purple heart emoji. That's really sweet. Thank you. I appreciate that. Melissa Shelton, another Melissa. I'm glad to see you seem in good spirits considering what you're going through. I'm a cancer patient currently in remission. My heart goes out to you. I hope and pray this infusion helps prolong your life considerably and your quality of life improves. Much love. Heart emoji. Double heart emoji. Yeah, I mean, like I said, now I'm having second thoughts about the infusion, but yes, thank you very much. And I'm glad to hear that you are in remission. Kathy G1 says, we saw your kitty. If I recall, your kitties have interesting names. Please tell us again. I just adore cats. Thanks for the update. Always good to hear your voice. Cat emoji. Yes, my cats are named Madja, M-A-D-J-A, which I believe is Arabic for glorious or honorable. She came with that name from the shelter, and I liked it so much that I kept it. My second cat, which I got a year after the first, is named Pazuzu. And that is the name of the demon that possesses Reagan in The Exorcist, and it's kind of a joke because she's a little demon cat. It's better than the name she came with. From the shelter, she came with the name Lulu, and I hated it. No offense to anybody named Lulu, by the way. I just didn't like it for a cat. Betty Jansen says, I started to comment wishing you the best and realize how empty that may sound. Not being in your shoes, not knowing how you were feeling, only imagining the uncertainties you were experiencing. I get what you mean. I do appreciate well wishes, though. Like, I understand that people are in a position of listening to me talk about something that is beyond anyone's control, and so they don't really know what to say or how to respond. It's fine if all you say is good luck, or I pray for you, or best wishes, whatever. It's fine. I get it. So don't feel bad about that. And she goes on to say, I can only say from my heart that I hope you will get through this. I'm not religious in any sense, and therefore I am not telling you that I'm praying for you, but know that I am in a way. See, there you go. And I think at this point that's the best anyone can do, and I do appreciate that people are by my side and care, and that's enough. I'm just going to do one more. Janet Loso? I'm sorry if I'm mispronouncing that. Can they put in a drain called a Denver drain, or Plerex is a brand? You can then just hook up a vacuum system to the catheter at regular intervals. I assume this is in reference to the fluid buildup in my belly. They said they're not going to do that. They would only do that if they absolutely had to, or as a part of hospice care. And I'm not there yet. So the occasional paracentesis is the way to go for now. All right, but scrolling through, there are so many comments, and I used to, when I first started this channel, I used to like go through and like read every single one of them and thumb them up and give them hearts. And I can't do that anymore because there's too many, And I try, but I can't get to everyone. So I hope you know that I appreciate every single comment that people leave, um, and it's, it does matter. So thank you very much for that. And like I said, good news tomorrow. Look forward to it. I'll post that about midday. So until then, take care.